Good morning. Coming to TikTok because I need some help. Be it if you're in the medical profession, and I mean real medical profession. I'm not looking for herbs. I'm not looking for anything like that. I'm looking genuinely for like Western medicine here. Nurses, doctors, familiar with this by all means, or patients. If you've gone through this, tell me your experience. Put it in the comments, stitch this, something, but I have some questions. Quick backstory, I had an emergency event with abdominal pain a couple months ago, went to the ER, they thought it was a viral intestinal thing. I was concerned because I'm a gastric sleeve patient from over a year ago, thought maybe it was a blockage, which I know is rare post a year, but I was concerned. So I went into the hospital because I was worried about that. So they tell me it's a viral thing, you're fine, go home, it'll get better over time. Fast forward a month later, same symptoms, severe pain, quick onset. Went to the emergency room. This time they find out that no, all the pain is due to a mass on an ovary. They treat the symptoms. I get referred to an oncologist for precautionary reasons. The oncologist reassures me at this time that it's a kind of mass, it's kind of a cyst that doesn't look cancerous. He's not worried. Okay, great. But he still wants to remove it just to be on the safe side. 10-4. His recommendation at this time is let's go ahead and remove everything. That way, if it is cancerous, you don't have anything else to worry about because those parts are removed. You don't have to worry about the cancer returning. Okay, no problem. I initially agreed to that, started looking into it, have some reservations, panic, a couple days before surgery. I'm like, I can't do this. I just remove the mass, remove the ovary. If you really think it's benign, there's no point in getting rid of perfectly good organs if everything is fine. So fine, they just do the hysterectomy, which is just where they remove the ovary, the mass. I'm still recovering from that. During surgery, they do a quick pathology. It's benign, but it still needs to be sent off for further testing. Further testing reveals that yes, in fact, there is cancer present. Great. So, meet with the oncologist, find this out about a week after surgery. Follow up for surgery, he tells me this, and he's like, here are your options. We can either do an intrauterine biopsy and make sure, because the type of cancer that I have is normally found inside the uterus, and chemo, or you can do a radical hysterectomy plus chemo. Now, some terminology things here that I have recently learned. There's various different kinds of hysterectomy, which I knew, but when you're talking radical hysterectomy, they remove everything. They remove your cervix, your ovaries, your uterus, even the fat pad that during pregnancy, as I understand, that's the purpose of this thing, it protects your internal organs from the baby moving during pregnancy and all of the things that pregnancy does. They remove all of that, which means I'd be gutted like a fish. Vertical incision from, as I understand it, just below my sternum, above my belly button, all the way down to my pubis. Which part of that is already cut anyway, but huge incision, and I have questions. So when I talked to him, I was like, look, I understand that, I'm perimenopausal as it is right now. I'm of that age range, and I know that even just with menopause, like, sex drive can wane, and there's changes, right? Like, I get it. I have been previously told I'm not a candidate for HRT, or hormone replacement therapy, for those of you who don't know what that is, because of a previous health issue as it relates to hormone therapy, specifically birth control. So I was like, okay, I know that that's in my future. I was like, but I know people that lack drive that can still have a healthy sex life with their partners. And I would like to continue that. So what can I expect? Like, what kind of, sensitivity will I retain? Physical sensitivity, like touch, right? Can I expect post-surgery? And he kind of chuckled at this point, which kind of set my teeth on edge then. But he kind of chuckled and he's like, none. He was like, even just natural menopause will cause you to lose sensitivity. He was like, and chemotherapy will cause you to lose sensitivity. He's like, the surgery, of course, will lose sensitivity, and all of these together will mean that you're effectively dead from the waist down. Now, are those his exact words? No. But I promise you that is exactly what he said. I am paraphrasing, but that was the point he was driving home, because I was very specific in my question. I see individuals that, and talk to individuals daily that have issues with drive and sensation and whatnot. And for men, it's pretty easy. They go to their doctor and they, unless there's something major, like they've had major prostate surgery, and nerve endings have been cut, but even then there's things that they can do, right? They don't lose sensitivity. They lose, from what I've understand from those that I've talked to that have gone through this, they don't lose sensitivity, they lose functionality. And women, we can be functional without sensitivity. So I understand function won't necessarily, it will be different, but it won't be, it's not like they're, sewing me up, right? Like, that's not happening. But my concern was sensitivity. And I know that there's surgical techniques that will allow a woman to have those nerves preserved. But I'm concerned that because of the way that he approached the answer to the question that I had, that's not his primary concern, nor is it something that he is even interested in doing. And I'm looking for help here. Is this something that no matter who I see, I am guaranteed I'm going to be dead from the waist down for the rest of my life? Which he's like, you'll live another, good 35 years or whatever, which, by the way, by itself was a gut punch. But, like, what kind of living is that? What kind of good mental health is that? What kind of good relationship health is that? Like, I know that that's not the most important thing, but anybody who says that that's not important to mental health, that's not important to relationships is everybody has their opinions. I think they're wrong, but if that's their opinion, but that is also my opinion. I can't wrap my brain around this is it. That's it. Now, I was given the option of an intrauterine biopsy, or a radical hysterectomy where, everything disappears. I need some guidance. Have you had a radical hysterectomy and you still have sensitivity? Did you have to approach this with your doctor and talk to him about, hey, I need you to be careful because I want to preserve those nerves? Did you have to get a second opinion? If you could refer me to somebody, let me know. Like, I'm curious. Any and all advice, help is appreciated. So put a comment. Let me know. Thanks.